Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So in the diaphragm, we have some incisions which are important in the diaphragm. So incisions that we put for the diaphragm are, so there are three types of diaphragmatic incisions which are circumferential incisions, central tendon incisions or radial incisions. Okay, so it's simple. If this is the diaphragm, circumferential incisions are like this. Central tendon are those which are put on the central tendon, and radial are transverse like this. So we will see each of them in detail. So first, circumferential incisions. Circumferential incisions are actually causes little loss of function. Because it is like this cause little loss of function. Now these circumferential incisions should be put at least 5 centimeters lateral to the edge of the central tendon. So if this is the central tendon, they should be at least 5 centimeters away from the central tendon, mainly to avoid the injury to the branches of the phrenic nerve, because branches of phrenic nerve were present within 5 centimeters of the central tendon. So always you should put the circumferential incision should be at least 5 centimeters lateral to the edge of the central tendon. Why? Mainly to avoid the injury to the posterolateral, to avoid injury to the posterolateral and anterolateral branches of the phrenic nerve. Okay, then it is difficult to put. It is a difficult type of incision, especially after a long operation. It is difficult to realign correctly. That is, you put an incision and you have done an operation. After operation, for realigning this incision is very difficult. So while doing the operation or before operation, we can put the surgical clips or put on the side of the muscular incision. On the side of muscular incision, surgical clips are put for better alignment of the incision after surgery. So this is circumferential incision.
thank you and thank you for watching.